So in my past two videos, the first one I spoke about my journey with autism. The second video, I talked a little bit about my credentials and my professional background. And I did state that I was going to talk a little bit more about occupational therapy and what that involves. I am an occupational therapist. I am licensed in the state of New York and in the state of Florida. I've worked in Connecticut, I've worked in New York, and I've worked in Florida. A little bit about occupational therapy. In occupational therapy, we use the abbreviation OT, so you'll hear people say the word OT a lot to refer to occupational therapist. Basically, we work in different settings to restore function, teach adaptive skills and modification techniques in order to promote maximum functional independence. And I'll kind of break down what that really means. So you think about yourself. We all have daily activities that we do. We all have daily routines. Being able to move around, getting out of bed, walking to the kitchen, getting a glass of water, washing dishes, doing house chores, brushing your teeth, taking a shower, taking care of your pet, participating in leisure activities. All those things are your occupations. They are your daily occupations. They are things that you do to occupy your time. So basically, when something happens to you in your life that impacts you in a way where you cannot participate in those daily activities like you should anymore, you then need occupational therapy. So with occupational therapy, we work in different settings and we work with people across the lifespan. So we work from babies, toddlers, young adults, school-age children, adults, and also seniors. And depending on the setting that you work, your goals are different. You work with different people, the goals are different, and everybody's maximum functional independence is not the same, doesn't look the same. So we assess the clients or the patients and we develop a treatment plan specifically tailored to that person in order to get them back to living their maximum potential life. So imagine something happened to you, whether it's an injury or it's an illness or a disability that prevents you from doing those daily occupations that you used to do. It prevents you from moving around like you used to move around. You then need occupational therapy. So when we work, depending on the settings that we work, we are developing, maybe it's an exercise program that we're developing for you so that you can gain your strength back. Maybe we're working with your arms, your fingers, your hands, to get you to do the things that you need to do to get back to work. So you'll see us in different settings. We work in NICUs, which is pretty much the ICU for little kids. So we work in the schools, we work in your home. So it can be with your child that has been diagnosed with autism in your home. We work with older adults that are in their home, whether they had an injury or a chronic condition or pain. We work with them in their homes. We work in nursing homes. We work in assisted living facilities. We work in outpatient clinics. We work in rehab centers. We work in prisons. We work in industrial workplaces. And we also have our own private practices that we also work on and see patients for different, whether it's pain or they just had an operation, they can't move their arm and they need therapy for that. Some occupational therapists, they choose to specify in a specific in a specific area where you'll see a lot of therapists, they like to work with amputees, working on developing the right prosthetics for people who's lost an arm or a limb. We work on wheelchairs, we work on positioning, we work on kids who are in school that need positioning techniques in school, that need some kind of sensory diet in school, that need to focus more in school. We work, there's also the possibility of getting specialized in low vision as well for people who have low vision or have difficulty seeing. We also work with your work area. We would come to your work. We would assess your work area and see where you can benefit from our work and the kind of position and technique that would work